Hello everyone, my name is Daksh Patel and welcome to my channel. Continuing with the forensic medicine series, this is a new video on injuries. This is also a very important topic. Like there are more than 20-25 types of injuries. We'll be discussing each of them in detail in the subsequent videos. This video will mainly focus on the classification, like how we'll be classifying 20-25 injuries under one heading. So I'll try to cover this video under 15 to 20 minutes. This is an introductory video of injuries. So I'm sorry I've not put any photos of the injuries. Okay, so without wasting the time, let us start injuries. Before going through the classification of injuries, first of all, we need to know what is injury. So that is the definition of injury. So injury defines as any harm illegally to any person, body, mind, reputation, or property. So injury doesn't only mean injury to the body. It also includes mind, reputation, property, etc. And wound means breach in continuity. Like skin is a continuous thing, and if you do a breach, then it is known as a wound. So this is the difference between injury and wound. Now going through the classification. Now you can see this whole classification. It seems quite monotonous, but this is very simple. We'll go through each of this. Okay, so injury can be classified through four various methods. Like you have seen, like you can see this causative factor, nature of injuries. These are not the types of injuries, but these are the methods through which we can classify injuries into further subtypes. Okay, so going through the first method, and that is based on the causative factors. Based on the causative factors. Based on causative factors, we have four subtypes, and they are mechanical, thermal, chemical, and miscellaneous. Mechanical injuries, thermal injuries, chemical injuries, and miscellaneous injuries. Now let us see mechanical injuries into detail. Mechanical injuries, let us trace this pink line, and mechanical injury is further divided into blunt force and sharp force. Blunt force injury and sharp force injury. What is blunt force injury? Blunt force injury means hitting any surface that has big surface area. Okay, and sharp force means the width of any object is very pointed or narrow as compared to the length. So it will pierce through the body. That is the sharp force injury. Okay. The blunt force injury includes abrasion, laceration, contusion, and fracture. These words are quite confusing, and many students find it confusing, especially in the second MBBS. In the third MBBS, as they are used to this word, it is quite easy. So let me explain you. In the subsequent video, we'll be looking this each of this injury along with photos. So it will be very easy for you to understand. But as of now, let me tell you what is abrasion, laceration, and contusion. So abrasion means friction of a body surface through any rough surface. In Gujarati, we call it cholai jau. Okay, so that is abrasion. So that is the removal of a superficial layer of the skin. Laceration means it is suppose here it is a skin, and below skin there is a hard surface, like for example bone. So if we apply a great force to the skin will touch to the bone and it will lacerate. I mean, it will split apart. So that is laceration. We'll look the images of laceration in the subsequent videos, but as of now, consider laceration under blunt force. Okay. Now, what is contusion? Contusion is extravasation of blood out of the blood vessels, but the skin is intact. So you might have seen while playing in the playground that you get some kind of injury and blood is accumulated inside the skin. The epidermis and dermis remains the same, like no breach in the continuity. In Gujarati, we call it bettomar. Okay, so that is contusion. Then we have fracture. So these four are under the blunt force. Sharp force includes incision and stab. These are also very simple words. Stab means stabbing a person through any sharp object. Depth of the injury is larger than length and width. That is the stab wound. And incision means slit like cut. Okay. So these are the blunt force and sharp force. So we are done with mechanical injuries. Now let us move to the second subtype of injury based on causative factor. Okay. So and that is the thermal injury. Thermal injury may be due to heat or may be due to cold. So due to heat includes burns, scalds. Burn is due to dry heat and scald is due to very hot liquid. Okay. And due to cold, we have frostbite and trench foot. The third subtype is chemical injury. It includes vitriolage. Vitriolage means acid attack. It can be alkali attack. It can be poisons. Okay. Now, miscellaneous includes electrical injury, blast injury, radiation injury, and lightning injury. So these are the four miscellaneous types. Okay, so we are done with causative the classification based on causative factors. The second method through which we can classify injury is nature of injury, based on the nature of injury, and they are simple hurt and grievous hurt. Grievous hurt are life threatening and they are uh, given under section 320 of Indian Penal Code, and they are grievous hurt. Grievous hurt includes fracture or displacement of tooth, emasculation, loss of sight, loss of ear. Uh, so they are considered as grievous hurt and simple hurt. Simple hurt means they are not endangering the life. So these two are the sub classification based on the method, and that is nature of injury. Okay. The third method through which we can classify injury is medico-legal classification. Medico-legal classification includes suicide, homicide. Homicide means murder. Accidental, defense wound. Defense wound means victim is trying to defend himself or herself from the attacker. So while defending, he or she may get kind of wound, and so they are defense wound. And fabricated wound. Now, what is fabricated wound? Fabricated wound is an artificial wound that is created by a person himself or some other person with the consent of the person concerned. So for why person needs a like artificial wound? So it can be to gain some insurance or to get away from heavy duty. So prisoners and soldiers do this fabricated wound in order to avoid kind of heavy duty. Okay, so these are the fabricated wounds. The fourth method is based on the time, and they are antemortem injury and postmortem injury. Antemortem means person was living and he was subjected to injury, and postmortem injury means after death, the dead body has been subjected to injury. Okay, so these are the four methods through which we can classify injury. One is causative factor, nature of injury, medico-legal classification, and time. And further, you can classify based on these four methods. There are further more classifications, and they're very easy. Okay, so how this question is asked in university exam? In Gujarat University, they generally ask as a 10 marker, in which they ask classify injuries, and they'll ask any one of the injuries. For example, explain abrasion in detail, explain contusion in detail, explain defense wounds, explain fabricated wound. So they'll ask the whole classification, like 4 mark and 6 mark, explain any one of them in detail. So you can write this whole classification as such. Okay, and it is very simple. Hope you like my video. In the subsequent videos, we'll be taking abrasion, contusion, laceration, fabricated wound, and defense wound in detail along with images. Okay, hope you like my video. Thank you very much. See you in the next video.